Hello, my name is Kara Vyers. I'm an MPH student at Liberty University. This presentation will cover a brief overview of my practicum project, as well as reflections, lessons learned, and future recommendations. A brief overview of my practicum: I worked with Child Family Health International at their Planned Parenthood Association of Ghana clinic in Accra, Ghana. This was a virtual practicum. I developed HIV pre-exposure prophylactic, or HIV PrEP, educational materials for healthcare workers and health agencies. And the main purpose of my project was to increase knowledge, reduce stigma, and inform policy, especially around lenacapavir use. I completed my 120 hours during the month of February of 2025. The main design of my practicum focused on systematic reviews. I did 2 systematic reviews comparing the 3 different types of PrEP. The first review looked at oral PrEP compared to injectable cabotegravir, and the second review looked at oral PrEP compared to injectable lenacapavir. And the final review looked at the acceptability of PrEP among adolescent girls and young women in Africa. I used a thematic framework to assess lenacapavir usefulness in Ghana. The framework included efficacy, safety, cost effectiveness, alternative options, feasibility, acceptability, and public health impacts. The main outcome of my projects looked at the pros and cons of each of the types of PrEP. For oral PrEP, it's easy to use. It's self-administered. The main drawback is the daily pill burden. For injectable cabotegravir, it's discreet. It requires injections every 8 weeks, so the main drawback with that is that it requires more frequent visits to a healthcare provider. And lenacapavir is also an injectable. It's discreet as well. And its biggest draw is that it only requires an injection every 6 months, which really helps with patient adherence. And then the final outcome was looking at recommended use of lenacapavir in Ghana. And overall, if lenacapavir can be produced generically at generic costs, it would be highly efficacious for HIV PrEP in Ghana. Most adolescent girls and young women want options, and this would add to those options, and they wanted an option with a longer time frame between injections, and lenacapavir would provide that. I had 2 main deliverables for my project. The first one was an educational poster for the clinic, which will be seen by health workers and patients alike, and it compared the 3 types of PrEP. It was titled "Let's PrEP for HIV/AIDS in Ghana." And the second deliverable was a PowerPoint presentation for health providers and health agencies with its main focus on lenacapavir, and it was titled "Exploring Lenacapavir for PrEP in Ghana, a New Era of HIV Prevention." There are multiple lessons learned and reflections as I look back at my project. First things first, I have gained an extensive knowledge of PrEP, especially those 3 main types, which included the oral, the injectable cabotegravir, and injectable lenacapavir. I also have a much better understanding of HIV/AIDS in Africa and some of the nuances with treating and preventing that disease. First off, the key and vulnerable populations, which include adolescent girls and young women, men who have sex with men, female sex workers, and people who inject drugs. And 3 of those 4 populations often have laws prohibiting those behaviors, and so it makes it hard to reach those patient populations as they are fearful of criminal backlash for seeking out help for their lifestyle. Another thing that I learned is that HIV is more prevalent in heterosexual relationships as compared to in the U.S., which is typically same-sex and men who have sex with men. In Africa as well, women are more disproportionately affected by HIV compared to men. And another eye-opening fact was that because Ghana has such a low national prevalence, they're often not included in randomized control trials or any studies looking at HIV, really even HIV prevention or HIV treatment because of their low prevalence. But it's important to know that these patient populations still need help, and there is evidence of increasing prevalence in their key and vulnerable populations. So it would be beneficial to have more studies done on patient populations in Western Africa. Perhaps the biggest reflection from my project is looking at my biblical perspective and Christian worldview. This project really challenged my worldview in really two distinct ways. First things first, I worked with the clinic that I partnered with is a Planned Parenthood affiliate. And Planned Parenthood, in America at least, has a reputation for supporting and conducting abortions, which really does go against my worldview of protecting human lives, especially the most vulnerable, like children in the womb. And then secondly, HIV PrEP mostly exists to allow people to have sex recreationally with limited to no consequences. And as a Christian, I believe that sex is sacred and is designed between the marriage between a man and a woman. But despite these challenges, this practicum really did provide a real world scenario for me as a Christian working in public health. It helped me to see how I can still be a Christian in these environments and work in partnership with maybe organizations or people that don't have the same views as me. I can still put my very best foot forward, and I can still deliver, the very best work that I can do. And it also helped me to see that a medication like HIV PrEP provides an opportunity for healthcare workers and public health agencies to be in contact and provides a point of contact with those vulnerable populations where hopefully the more we're in contact with them, the more trust can be built, and we can really help those populations. And hopefully over time, there would be more of a culture change, which I really think is what's needed to end the HIV/AIDS epidemic. And lastly, the one thing I would have changed was I would have loved to have gone to Ghana in person. I'm a third culture kid. I've traveled the world, and there really is just something to be said about being in the culture that you're in and trying to help. And so I would have loved to have been able to travel to Ghana, seen the clinic, be in the clinic, work with the people, because I think it would have provided even more insight into global health, which was what my concentration is. There are two main challenges. First, the limited available literature. There are no randomized control trial studies for HIV PrEP in Ghana. And like I said earlier, that's mainly because of their low prevalence of HIV. And then secondly, within the last 5 years at least, there's no HIV PrEP implementation studies in Africa or Ghana, especially with regard to the injectable PrEPs. So it really challenged my project, especially with the operational feasibility. It was hard to find evidence-based recommendations for how lenacapavir could be implemented successfully into Ghana and their key and vulnerable populations. And the second major challenge was my preceptor meeting days. I had Zoom meetings with Dr. Charles on Mondays and Friday mornings. And the Monday mornings, he would provide feedback and recommendations, which I could make then throughout the week. And then by Friday, I would be ready to go. On Fridays, he would do the same thing, provide feedback and recommendations. And that turnaround from Friday to Monday almost always required me working on the weekends. So that created somewhat of a challenge, as I am a mom and I do have a family. But in the end, it ended up being okay. Lastly, my recommendations, I highly recommend CFHI to future students. They're a professional and very organized organization. Their communication was excellent from the time that I inquired about their opportunities for practicums all the way through just recently with my preceptor evaluation. They had a quick turnaround time with questions, and they were always available to help. They provided me with a very thorough global health practicum experience, and I would honestly recommend maybe even a formal partnership with CFHI and Liberty University, as this would allow students to travel together for on-site practicum opportunities. I was hesitant to travel to Ghana by myself without really knowing the organization or the people there, or if any students like myself had even gone from Liberty. And so I think if CFHI and Liberty had a formal partnership, it would solidify that for future students. They have virtual opportunities, they have hybrid opportunities, and they also have in-person opportunities. So those are my recommendations. This concludes my presentation. I'm very grateful for my experience with CFHI and as well as my experience with Liberty University for my MPH, and I'm looking forward to how this will impact my career in the future. Thank you so much.